Episode 27A, August 27, 2022. A study by researchers from New York and Alabama on the feasibility of low-cost particle sensors in long-term indoor air pollution health studies concluded that the PM 2.5 sensors Airbeam 1 and Airbeam 2 could possibly need to be recalibrated after long-term use, before being used for indoor PM 2.5 health studies. This study was limited to considering indoor PM 2.5 monitoring and largely limited to specific monitoring of cigarette smoke in the indoor air, in public places such as subway systems. The study considered that another PM 2.5 indoor or outdoor PurpleAir monitor did not have any discernible need for recalibration after long-term use. One reason given by the researchers for PurpleAir monitor long-term use without need for recalibration was because PurpleAir monitors are manufactured with 2 laser counters, and Airbeam monitors contain only 1. The study stated a PurpleAir device evaluates individual sensor degradation by continually comparing the output of 2 low-cost Plantower PM sensor units built into each monitoring device. Engineers are concerned with the need for calibration, especially for machines with moving parts that may wear out. The idea of the need for calibration was Standard Environmental Protection Agency EPA PM 2.5 sensors, which cost over $100,000 and exist side by side with PurpleAir monitors on U.S. government AirNow smoke and fire maps, is a concern that engineers often have. But the PM 2.5 level data from PurpleAir sensor data can be correlated with the PM 2.5 level data from EPA monitors using a simple mathematical formula. The difference in methods of initial collection of data between PurpleAir and EPA sensors means that results will never be exactly the same initially, and there is need for a mathematical formula to correlate the two. There is no need for mechanical calibration, since the mechanism of PurpleAir and EPA sensors are different, but neither are defective. PurpleAir sensor laser counting of particulates every 10 minutes in real time is different from EPA sensors physically collecting and weighing PM 2.5 particles and calculating the percent of heavier gravel density and lighter wood density particles and coming up with data on PM 2.5 levels in the air every hour. Because by the mathematical formula the data can be correlated, EPA and PurpleAir sensors can give good, reliable information to the public about levels of PM 2.5 on the U.S. government AirNow map of smoke and fire. For instance, in Wisconsin, approximately 15 EPA sensors are in use on the Wisconsin portion of the map, and approximately 55 PurpleAir resident-owned sensors are in use by the general public on the Wisconsin portion of the map. The data is considered reliable for that purpose, showing levels of smoke PM 2.5 in the air. PurpleAir PM 2.5 data is also considered reliable for medical research studies. For example, a study published in August 2022 in Sweden using data from low-cost PurpleAir PM 2.5 outdoor sensors found that heart arrhythmia increased for certain studied populations when outdoor PM 2.5 levels at the hospital where patients were studied increased, even by small amounts. Other differences between Airbeam and PurpleAir sensors are that Airbeam 1 was introduced to the public around 2006 and PurpleAir was founded in 2015 in Draper, Utah. Since 2006, Airbeam sensors have been on a habitat map, which now shows sensors in the metropolitan areas of Los Angeles, Chicago, New York, and the Louisiana, Alabama, Mississippi Delta urban area. Habitat map is often used as an educational tool for school children. PurpleAir monitors are used extensively all across the U.S. since 2015. PurpleAir offers different sensors for indoor use and for outdoor use. Airbeam 1 and 2 offer monitors that can be attached to bicycles and other mobile vehicles. Both PurpleAir and Airbeam can cost as low as $249 per sensor to the residential consumer,